After heart surgery, one of the most common and anxiety-provoking experiences patients report is noticing that their heart rate is higher than usual, even while resting, and this phenomenon, called tachycardia, often leads patients to fear that something has gone wrong with their heart, but in reality, a faster heart rate during the early and even intermediate recovery phase is frequently a normal physiological response rather than a sign of danger, because surgery itself places the body under controlled trauma, triggering stress hormones like adrenaline and cortisol that naturally increase heart rate to maintain blood flow, oxygen delivery, and healing. Additionally, during heart surgery, the heart is touched, stopped, restarted, stitched, and sometimes electrically irritated, which temporarily alters the heart's natural pacing system and makes it more sensitive to stimuli, meaning even small triggers like standing up, walking, pain, anxiety, coughing, or mild dehydration can cause noticeable pulse increases. Pain plays a major role here, because pain signals activate the sympathetic nervous system, the body's fight or flight response, raising heart rate and blood pressure as a protective mechanism, which is why adequate pain control is not just about comfort but about heart protection. Anemia is another very common contributor, since blood loss during surgery lowers hemoglobin levels, forcing the heart to beat faster to deliver sufficient oxygen to tissues, and until blood counts recover, a higher pulse is often expected. Dehydration further thickens the blood and reduces circulating volume, prompting the heart to compensate by increasing rate, which is why cardiologists emphasize frequent small sips of water unless fluid restriction is advised. Medications also play a role. Some drugs used after surgery, such as diuretics, inhalers, or temporary withdrawal of beta blockers, can elevate heart rate, while others are intentionally adjusted slowly to avoid sudden drops in blood pressure. Emotional stress, fear, sleep deprivation, and constant worry about recovery also stimulate the nervous system, keeping the heart rate elevated, especially at night or early mornings. Infections, even mild ones such as wound infections or chest congestion, can raise heart rate as the body mounts an immune response, making tachycardia an early warning sign doctors monitor closely. However, it's crucial to understand the difference between expected recovery, tachycardia, and dangerous rhythm problems, because while a steady fast heart rate that gradually settles with rest is often normal, warning signs include persistent heart rate above 120 to 130 at rest, sudden irregular pounding, dizziness, fainting, chest pain, breathlessness at rest, or palpitations that do not settle. These require immediate medical evaluation. Recovery phase tachycardia usually improves over weeks as pain reduces, sleep normalizes, blood levels stabilize, fitness improves, and medications are optimized, and patients can actively help by pacing activities, avoiding sudden exertion, practicing slow deep breathing, staying hydrated, managing anxiety, sleeping adequately, avoiding caffeine and nicotine, and following medication instructions precisely. Most importantly, patients must remember that the heart after surgery is not weak but healing, and like any healing muscle, it temporarily works harder before settling into a stronger, more efficient rhythm. So, understanding tachycardia replaces fear with confidence, allowing patients to focus on steady recovery rather than panic, while regular follow-ups ensure that normal healing patterns are distinguished from conditions that need intervention, making knowledge itself one of the most powerful tools for heart recovery.